When you have a mission-driven community where every member is batteries included, meaning they give more than they take, it creates an exponential energy that makes that community unstoppable.
Health Moonshot Communities are our approach, unique approach to bringing together the founders and the CEOs and the entrepreneurs and innovators at the center of this transformation, and then wrap around all of those stakeholders the kinds of collaborators they need.
I think the key here is to start big picture, start with the biggest thing first, and really get to this idea of we've had a fundamental shift at Startup Health, and we want to explain to people what that is and why.
I don't think about it as a fundamental shift. I'd probably describe this as the continued evolution of our thinking about how to go really deep with founders who are working on solving similar problems or challenges that we're facing around the world, whether it's tackling Alzheimer's disease or type 1 diabetes. And I think the real magic is that we're going deeper with founder community than we ever before.
You know, we had a formula we outlined the day we launched, which was health transformers times the network effect equals the transformation of health.
Healthcare.
Right? Health transformers, these are the extraordinary superheroes of our time. These are entrepreneurs, these are founders, these are the builders and makers that are innovating and creating the future every day. But the network effect is this extraordinary unlock, an exponential unlock of community.
Talk to me about what a Health Moonshot community is and why that is something worth spending this kind of emphasis on.
Well, I probably have to peel back a little bit towards what a founder community is. Founder communities have been around for decades. I think YPO was founded in the 40s or 50s, and there's lots of different variations of YPO and EO and Vistage. And the power of those communities are people from different backgrounds and experiences coming to, and industries and businesses coming together and sharing generally different challenges related to their business. That was one of the unlocks to like really the launch of Startup Health back in 2011. The need to build a community of just founders working on transforming healthcare.
We all see this in our own lives. We're all involved in communities, and you see the power of communities. I grew up in a farming community in Iowa, and I use the word community very specifically here because neighbors help each other. If you're snowed in and your neighbor has a tractor and they can plow you out, they come over and help you out. The magic that I think we were really inspired by came from NASA and the original moonshot, because when you can align the power of community and collaboration with a mission, a bold, audacious mission, and everyone is mission aligned around that goal.
When JFK made that, famous vision statement in 1961 or 62 at Rice University around, we're going to land a man on the moon and bring him safely back for the end of the decade. The technology didn't exist for that to happen. The funding didn't exist for that to happen. But that catalyzing statement that he made created what really snowballed into a collaboration between more than 400,000 people across 20,000 organizations and agencies, all contributing their unique capabilities to the mission. So when we think about curing Alzheimer's disease or tackling diabetes, type 1 or type 2, or any of the cardiometabolic diseases, it seems as though applying the same framework of mission-driven collaboration seemed very apropos. And so a lot of our framing is around how do we unlock that same collaboration around missions that we all know are shared by hundreds, if not thousands, of entrepreneurs and innovators and funders and partners around the world that want to help. But prior to this, everyone seemed to be working alone. It seems as though there's a lot of silos, not only locally, but within universities and industry and payers and providers and pharmaceutical companies and startups and big companies and small companies. And so these Health Moonshot communities are our approach, unique approach to bringing together the founders and the CEOs and the entrepreneurs and innovators at the center of this transformation, and then wrap around all of those stakeholders the kinds of collaborators they need. The big secret here is to do it in a way that enables us to be around 100% mission aligned people. When you look to your left, when you look to your right, when you look on the screen, you know that everybody's on the same mission you are.
Yeah, you mentioned EO and YPO, and we all know that communities rise and fall by the quality of their members. They're all about people. So talk to me about the vetting process. You just said 100% mission aligned. Obviously, that's a bit of an intangible, can be challenging to kind of know exactly where people are at in their mindset, or maybe there's, a great way to do it. How do you vet for a community like this?
We spend a lot of time talking about a couple of very simple things that we look for in the characteristics and the mindset and the attitude of the founders that are applying. Do they have the health transformer mindset, the mindset that not only says I'm thinking transformationally about a really long-term vision that is ambitious and seemingly unachievable alone, but through collaboration is possible?
How do you filter for that? I mean, it comes down to the health transformer mindset. Does everyone in that community, are they aligned with that mission? Why are they there? What's their purpose, right? That's number one. And then two, this batteries included construct, I think is really fundamental because it's binary. People either are willing to give more than they take, or they take more than they give. It's binary. And when you have a mission-driven community where every member is batteries included, meaning they give more energy, they give more than they take, it creates a fusion. It creates an exponential energy that makes that community unstoppable.
This filter is the first filter. It's not the only filter, but if they don't have what we just spent the last few minutes talking about, there's no reason to go to the next filter. There are a lot of really great companies and technologies that don't have founders or leaders that we would want in the community, or the other members of the community would gel well with. And so the energy up front on this really helps out. But the other dimension is about the company, who's on the team, who are the advisors and funders and partners of the organization. And then, of course, the technologies and the patents and the uniqueness of the capabilities of those organizations are important. But what we found over the last 13 years is that across the more than 550 companies that have joined the broader startup health community, what's really fascinating is things change about the companies. Companies evolve, and if they're good, they'll iterate their way to customer and product market fit.
A lot of talk about collaboration. Collaboration is wonderful. People love collaboration. We had to have collaboration to get to the moon and back. But the devil's in the details of how you actually cultivate collaboration and a culture of collaboration. So talk to me about, and this is a way of getting into the actual program. What do people get when they join the Startup Health community?
What's really magical is just pausing as soon as we finish the sentence. 100% mission aligned founders and CEOs. Hard stop. You're in a room with founders and CEOs who are building companies that are trying to solve different aspects of the care continuum for Alzheimer's disease and related dementias. Just that idea that you're in a room of rarefied air, of unique capabilities and unique access, is so significant that if I didn't even tell you all the different activities that we do together, the different events that we have, the peer circles that we bring entrepreneurs together in every month, the office hours that we host on a weekly basis to help the founders both connect with each other, but also support through our team and our experts. If we didn't talk about the in-person events that happen at conferences, just the idea that you're in a unique room, virtually or in person, that has curated people based on their mindset, based on their companies, based on their mission, that alone is significant.
One of the, I think, extraordinary innovations that we've learned from over the past at least 2 years is going really, really deep into each moonshot community, each health moonshot community. So the type 1 diabetes community, the Alzheimer's community.
We do founder intro calls every week or two, and we bring together complete strangers who are working on type 1 diabetes or working on youth mental health or working on women's health challenges. As soon as you put them in a virtual room together and they say hello and they tell you what they're working on, they instantly share a language. They instantly share the same kinds of customers or challenges or capabilities or problems or clinical trial issues, whatever it might be. And it's almost like a magical game of pinball where all of a sudden you just see the connections. It's around wisdom. It's around people they know or organizations they know or need access to. And it's about capabilities. The magic happens just in the first 5 minutes of talking and knowing the secret handshake for each other, because we're both talking about the same thing. You feel supported, you feel heard, and most importantly, the unlock is we all leap, weeks, months, or years ahead of other conversations because we're in that unique spot where the curation has already been done.
I want to make sure folks listening to this know how and if they should take action on this, because I know that one of the shifts that we're discussing here is how we build the community and who might take part in the community. So maybe Unity, I'll start with you, but you can both answer.
If you're a mission-driven founder building a health moonshot company, you should go to startuphealth.com and apply, check out our health moonshots and apply to join one of these communities. One of the things I'm most excited about, and we haven't talked about yet, is how we're opening up access to these communities. We've been very, very thoughtful about creating a membership model that enables the best of the best to really join these communities, to raise their hands, make it frictionless, accessible, and to be a part of these communities. We've got over a dozen of these Health Moonshot communities. And if you're working on a Health Moonshot not yet represented, we want you to be the founding member of one of our next Health Moonshot communities.
In answering your question about who should apply and who wants to join, it's like if you, number one, don't want to go at it alone and you want to do it with other people who are on a shared mission with you, and you want an opportunity to not only get support from the other founders, but get introduced to and get exposed to through these impact boards and showcases, but also through what I think we've done really well, led by you, in fact, over the last many years, is the idea of our media reach that I think through newsletters and social media and video on YouTube through Startup Health TV and our podcast, Startup Health Now, that you're listening to now, I think we have created an incredible active audience of people who are reading and watching and listening to the stories of progress that the founders in our communities are making, and they're reaching out to them and they're engaging with them. And so the big unlock here is founders who want to be a part of a unique peer network, but also have unique exposure to the broader audience of mission-aligned stakeholders they need access to. Those are the people that should apply. As Uni said, an easy visit to go over to startuphealth.com and check it out and engage on one of our founder intro sessions. And in 5 minutes into the hour-long session, you'll get it really quickly.
We have an Alzheimer's Health Moonshot that's championed with Gates Ventures and ADDF, the Alzheimer's Drug Discovery Foundation. And they're just extraordinary collaborators and partners right there. Well, we're helping bring that community together. We already have over 20 teams, research teams, innovator teams, technology teams working together on the very critical mission of eradicating Alzheimer's and related dementias. We're now opening that up to the next 20 members to join that thriving community and really supercharge it. In fact, we thought it would take us about a year to get the first 20 in that community. We did it in the first 3 months, and which is why we're now expanding that community, because we're seeing so much progress so quickly. We're seeing the connections happen by bringing these innovators together, they're all helping each other, learning from each other, and it's just absolutely speeding up the progress that everyone's making. So we want more of that across all of our health moonshots.
Very nice. Well, this will have to be the first of many interviews where we kind of go even deeper on this topic. But I appreciate you guys taking the time, pulling the curtain back, explaining what we're working on, and how people can get involved. So thanks a lot.
Thank you, Logan.
Thank you.